Welcome to Nursing Mantra family. Nursing Mantra study materials includes previously asked DHA, MOH, HAAD and all other PROMETRIC exam questions and answers. Here is our updated Nursing Mantra study materials for nurses 2020. So, recent DHA questions June 2020. They were asked regarding diabetic insipidus. What is the management, nursing management for diabetic insipidus? Post-op thyroidectomy management. Fibroid uterus. What is the hemorrhoid management? What are the complications of hysterectomy? Some situational questions they were asked. Drug calculations were there and community situational based questions, psychoanalysis theory. And regarding the research, qualitative study designs they have asked. Affective disorder. Then related to the sociology questions like ecological and biological social interaction, biological interaction based question also they have asked. What is systemic lupus erythematosus? What are the complications? So I mentioned here management, diagnostic criteria, what are the symptoms of SLE, all those things I have mentioned, and the management of SLE also mentioned here. Then they have asked regarding delegation of authority. What are the process of delegation of authority? What is the hypophysectomy care management? Nursing care, what is the nursing care after hypophysectomy? A lot of questions I updated here in this recent DHA exam. Just now we discussed some of the topics in the exams. Questions are not direct, but if you study the content of this material, so it will be easy for you to answer the questions which is asked for the exam. For all PROMETRIC exams, they will ask direct previously asked questions, or the question content will be the same, but pattern is different. As an applicant, you should be cunning to identify the keys in the questions. If you study the content of Nursing Mantra study material, which includes questions in different patterns in different authorities, it is easy to identify the answers in your exam and save your time. You can see here like recent DHA questions, MOH questions, and I have included the HAAD questions, Qatar PROMETRIC, Saudi PROMETRIC, Oman PROMETRIC, all the authorities exams questions I included here, and with the help of pictures it will be easy for you to study. So here I mentioned common PROMETRIC questions related to the nursing diagnosis. So important nursing diagnosis, how to identify this type of questions also they will mention. They will give us situations and they will ask which nursing diagnosis we can implement in this question, like that questions they are asking. And some of the other questions I noticed that they will ask some of the important things which is happened while we are giving the care of to the patient, so we cannot take a decision. So in that case what you will do? So you can tell like most of the answers will be inform the doctor, like that options will be there. If you find the inform the doctor, that is the initial first step, then most of the time the answer will be the inform to the doctor, like that, inform to MRP. So like that questions will be there. And priority, always the, as we know that ABCD, airway clearance is the main priority in nursing diagnosis and all. So according to the questions, and you have to like you have to read it 2-3 times the questions and fast reading. And even though if you are studying this book contents also, it is easy to identify which is the correct answer and how it came. You can evaluate the questions. So here we can see what are the important topics which is asked for the community health nursing. Just a rough idea regarding the tuberculosis. So tuberculosis mainly they will be asking regarding in the part of community health nursing. So where we will inform if you find out a tuberculosis cases. So we have to inform the primary health center as a community health nurse. So which needle you will use for the like intradermal injection for the tuberculosis Mondox test, that is the 26 gauge needle we are using. Tuberculosis, what is tuberculosis? What is the organism which is causing? It is Mycobacterium tuberculosis. The other name is AFB, acid fast bacilli. And tuberculosis, we can say that it is airborne. So this airborne isolation is required. What are the clinical features in tuberculosis? We can say clinical features like there will be productive cough will be there. So in the night fever will be there, sweating, weight loss, hemoptysis, fatigue, anorexia, then night sweats and weight loss, lack of appetite, everything will be there in the tuberculosis. So especially you can see the productive cough, it will be more. What is the screening test we are using here in tuberculosis? That is Mondox test. To check the antigen antibody reaction, 0.1 ml of the purified protein derivative, PPD we are calling it as. So we will be injecting in the left forearm intradermally. Duration, the induration we are checking 48 to 72 hours. So the induration there will be, the size will be there. For the children or the diabetic patients or pregnant ladies, it will be more than 10 mm, and normally it will be more than 15 mm. And if HIV patients means it will be more than 5 mm. So that is regarding the result, and the positive result means immunocompromised patient more than or equal to 5 mm. Age more than 4 years more than or equal to 10 mm. Then age less than 4 years more than or equal to 15 mm. Once the Mondox test is positive, lifelong the Mondox test will be positive. That also a question there which they can ask. But the questions they were asking in different too many confusions will be there in the questions, but the content will be this, the keyword will be the lifelong Mondox test will be positive even if once it gets positive. And false positive also we can say recent BCG immunization like vaccinations and a TB positive patients, we can say that false positive cases also we can find out. So if in this case we should not administer the live vaccines like MMR, varicella during the skin test. And chest X-ray we can say the consolidation will be there in the upper lobe, infiltration will be there in the chest X-ray. And TB confirmatory test is sputum test, it's not Mondox test, okay. Confirmatory test is sputum test, acid fast bacilli culture we are doing, early morning samples we are taking, and while taking the samples inform the patient, don't do the mouthwash with mouthwash solutions and or the early morning fresh sputum sample we have to send for culture. And there is another test is quantiferon TB gold blood test will be, the result will be available less than 24 hours and more specific than the tuberculosis skin Mondox test, skin test. So it's rarely done because of it is expensive test. So quantiferon TB gold test will be there. What are the management for the TB? There will be isolation, we are, as we told that we are giving the negative pressure room airborne isolation, and the nurse who cares or the healthcare professional who cares, they have to wear the N95 mask. In the room there should be HEPA filter and all airborne precautions we have used for this tuberculosis. And for the TB we have to provide high calorie and high protein diet to the patient, and inform the patient to increase the fluid 3 liters per day. And 1 to 2 weeks after 3 consecutive sputum culture, no need for isolation. If it comes negative, then no need for isolation. Then anti-tubercular treatment we are giving, that we are saying that DOTS therapy. DOTS means directly observed treatment, short course chemotherapy. So to prevent the antibiotic resistance or multi-drug resistance. What are the drugs we are using here is isoniazid, rifampicin, paracetamide and ethambutol. So it is having different side effects will be there. Each medicine is having different side effects. So regarding that also they can ask for the exams. So you can read the side effects of the medications, and there will be first line drugs and second line drugs. Second line drugs like vancomycin, tetracycline and streptomycin like that. So related to that so many questions they are asking continuously. So in complete these books I have mentioned most of the questions which is asked in different subjects like community research, statistics, all the subjects it's included. Most of the nursing contents I selected, and the previously asked questions it is repeated here for this exam purpose. So I cannot read all the questions which is and I cannot show all the questions because lack of time, so I cannot read all the questions which is mentioned here in this book. So if anybody needs to purchase this book, you can contact me in WhatsApp. The WhatsApp link I mentioned in the description box. You can click on the link and you can contact me in WhatsApp if you want to get this material. The drug calculation related with questions is available here. So I cannot read all the questions whichever is here in this book. So all the like, and also I have mentioned like each subject's important points. In maternity health nursing, what are the important points you have to remember, and in psychiatric nursing, what are the important points, community health nursing, what are the important points. And I have mentioned regarding the ECG patterns, how to assess the ECG. Then some of the pictures which is asked for the exams, and like ECG different, how to analyze the ECG rhythms and all, and important emergency medications and its uses, and nursing care and different positions, medications, everything I mentioned here. So it is easy for you to it will be a complete book for you to study for the PROMETRIC exam. Nursing Mantra material is more beneficial for those who wish to learn quickly for their preparation of DHA, MOH, HAAD, Saudi, Oman, Bahrain, Qatar PROMETRIC exams. If you wish to know more details about this book, feel free to contact me in WhatsApp. WhatsApp link I mentioned in description box. If you didn't subscribe Nursing Mantra YouTube channel until now, please subscribe now and enable the bell icon to get the updated notifications.